Welcome back for another Share Facilium video. Today I'm going to share the remarks that I made at the Gold Humanism Honor Society induction ceremony at my medical school. If you're unfamiliar, the Gold Humanism Honor Society is an organization that honors medical students and resident physicians and faculty members for their humanism in medicine and their commitment to compassionate care. It's a big honor to be selected, and it was a big honor for me to get to give the keynote address at my school's induction ceremony. So I'm going to share with you what I said. I'll try to get through it a little bit better than I did at the ceremony itself. Here you go. Thank you for inviting me to talk at tonight's Gold Humanism Honor Society induction ceremony. Joining the Gold Humanism Honor Society really is a high honor. We've got a lot of awards and rewards for medical students who excel in academics and research, and I know many of you receive awards for those things too. But to be recognized by your peers and your faculty for your dedication to providing compassionate patient care, it's a big deal, and I'm proud of you. So tonight I'm going to tell you just a little bit about me and how I ended up doing what I do now. And I'm going to tell you a lesson that I've learned over the course of my career. And to do that, I'm going to tell you a story, or try to tell you a story, that I've actually never talked about with anyone. So as you all know, I'm a pediatric nephrologist. And as many of you know, I also have a social media alter ego, the Sheriff of Sodium. And as the sheriff, from time to time, I comment upon or analyze certain issues in medical education. One thing that's always fascinated me is specialty selection. I don't think I'm alone in this. You guys know Dr. Glockenflecken? I see lots of heads nodding. If you didn't know, there's this physician and comedian who makes short satirical videos about different medical specialties. It's all done in good taste, and he has a huge audience, which I think goes to my point about how this topic is fascinating to a lot of people. Anyhow, if you ask people why they chose a particular path in medicine, they'll give you reasons. Most of them are very good reasons. I mean, I could give you many reasons why I became a pediatric nephrologist. But for some people and some specialties, there may be reasons that were important reasons, but they're not ones that you talk about as readily. I mean, you don't say that you wanted to become a such and such because you wanted to drive a Porsche SUV or be off work every day by 3 p.m. But if you ask me why I became a pediatric nephrologist, well, it's not to drive a Porsche SUV or be off by 3 p.m. I could give you lots of good reasons, but they wouldn't be those two. Honestly, if you asked me that question, I would probably give you the answer that I told you during your kidney module as second years, which is that the kidney is, at every level, the most beautiful organ in the human body. And if you asked me for other reasons, I could give them, and they'd all be 100% honest reasons. But if you made me tell you 100% of the reasons that I chose pediatric nephrology, there's one reason that I usually don't talk about. But I'll share it with you tonight because sharing it will lead into a story that will lead into one of the most illuminating and important lessons that I've learned in my career. And that's really the thing that I want to share with you tonight as you're inducted into the Gold Humanism Honor Society. But here's a reason that I don't talk about. I struggle with death. My first rotation in medical school was internal medicine. For me, that was great because when I came to medical school, I dreamed of becoming an internist. That's who my role models were, and that's what a doctor was to me. But as I did my internal medicine clerkship, I soon had the opportunity to care for many patients whose illnesses, unfortunately, were terminal. And in a couple of cases, I got to sit in on those heartbreaking conversations with the family where we said, there's nothing more we can do. Oh God, I hated those words. There's nothing more we can do. And if I'm being perfectly honest, although I loved internal medicine, the fact that there was so much death is one of the things that helped steer me away from that field and eventually toward pediatrics. And within pediatrics, there were lots of reasons I liked nephrology. But one of them was that because we have dialysis. And because you have dialysis, I mean, in a way, nobody should really die of kidney disease per se. I don't like to say that part out loud because it makes me sound cowardly. But tonight I'm trying to be honest, and it's honest for me to tell you that in some way, I gravitated toward my field because I didn't want to have to tell patients there's nothing more we can do. Because if you're a nephrologist, if you're smart and your access is good, you can be the kidney. There's never a time when there's nothing you can do. I mean, you can do dialysis. You can become the most beautiful organ in the human body. You think I jest. Well, let me tell you, there's some times when dialysis is awesome. Let me give you an example. Not too long ago, I got to meet a teenage girl who was admitted to the hospital after taking an overdose of metformin. She'd been depressed, but this was an impulsive act. And a while after she took the medicine, she became scared and regretful, and she confessed to her parents, who whisked her away to the hospital. But the dose that she'd taken was large, very large. And by the time she arrived, she was already developing severe lactic acidosis, and so I got consulted to provide dialysis. But her condition rapidly deteriorated, and she developed catastrophic cardiorespiratory collapse. We had to do her dialysis through her ECMO circuit, and for a while there, she was about as sick as a person can get. But after a couple of days, she began to improve, and eventually she had a full recovery. It was a remarkable case. It's actually one of the largest, if not the largest, metformin overdoses that's ever been reported. A couple of our pediatric residents actually presented it as a case report at a scientific meeting. And I'm not trying to suggest that it was me that deserves this credit, because there were obviously a lot of people who worked very hard to get her back from the brink of what seemed like it was going to be a horrifically tragic outcome. My piece was a small piece. It took everything to go right, but dialysis was one of those things. Of course, I've had lots of other cases that didn't go so well. And one of those is what I'm going to try to share with you now. But like I said, I've actually never talked about this story before. And this one was a hard one for me, and it still is when I think about it. But I'm going to share it because I think there's an important lesson here. I got to warn you that this story will be upsetting to some of you, and it's not going to hurt my feelings a bit if you need to or just want to get up and leave. This happened a couple of years ago. I won't say exactly when, and some of the minor details I've changed to preserve confidentiality. But the core elements of the story that I'm going to tell authentically and with high fidelity, because it's ultimately not my story. It's the story of a little baby girl I'm going to call Violet. I met Violet after being consulted to help with dialysis in a baby who'd just come in following cardiopulmonary arrest. From the brief initial history we got, it sounded like a case of sudden infant death syndrome. Her parents were tearful and distraught and described to us how they'd put their 4-month-old baby girl down for a nap just a few hours before, and everything seemed well. But when they went back to check on her a few hours later, what they saw was every parent's worst nightmare. Violet was perfectly still. Her skin was slightly cool to the touch. Her lips were tinged blue and she wasn't breathing. Her parents told us how they screamed, and they started CPR, and they called 911. When EMS arrived, she had a pulse, but it was weak, and it was obvious that she would need everything that medical science had to offer if she was going to survive. So they rushed her to the hospital, lights on and sirens blaring, and after a quick pit stop in the ED to get intubated, scanned, and temporarily stabilized, she was whisked upstairs to the pediatric intensive care unit. That's where I met her, because following her arrest, she had multi-organ system failure and was anuric. She had severe metabolic acidosis and hyperkalemia. She needed dialysis. But as everyone worked to stabilize Violet's condition, it started to become clear that there was more to her story. That head CT that was done in the ED, it showed cerebral edema and subarachnoid hemorrhage. We looked at the chest x-ray, the one that was done to check the placement of her ET tube. But when you looked at it closely, it showed multiple rib fractures in various stages of healing. Violet had had a cardiopulmonary arrest, yes, but it had been precipitated by inflicted trauma. As we got ready to start dialysis, the neurosurgeon arrived to discuss Violet's case with the intensivist. These were two of our most experienced physicians. I stood a few steps away listening to their conversation. I noticed their sad eyes and that soft, serious tone that comes, unfortunately, from experience in similarly tragic and horrific cases. Based on the severity of her injuries, they both agreed that she would likely progress to brain death. So we paused, and we had a discussion about whether starting dialysis was actually in her best interest. It seemed very unlikely to change her ultimate outcome. In a different scenario, there would have been a heartbreaking discussion to have with the parents about how there was probably nothing we could do that was going to change the outcome for their child. But at this point, Violet's case wasn't just a medical case, it was a legal one. There were now police detectives waiting in the hallway. If Violet succumbed to her injuries, it could result in homicide charges. We agreed that since her neurologic prognosis wasn't certain, we couldn't let her pass away. At least, not from hyperkalemia, not tonight. So we got ready to begin dialysis. It's technically challenging to perform dialysis on an infant. There's a real risk that a little baby won't tolerate the extracorporeal circuit, that having blood volume outside their body will precipitate shock. It's especially true when the patient is as sick as Violet was. So as we got her onto the machine and for the hours afterward, I was there at her bedside, monitoring the machine flow and her perfusion. So I'd hold her tiny little foot in my hand and monitor her pulses. And this is the part that I remember the most, the part that sticks with me even years later. Her tiny little toenails were painted a sparkly purple. It was the unmistakable sign of a caregiver's love and delight with their baby, and yet it was so horrifically juxtaposed to the purple bruising that was now emerging and apparent on her chest and head. And as the minutes and hours passed, I couldn't help but stare and wonder why. It took almost 2 days, but my colleague's prediction about Violet's prognosis proved correct. By that time, her cardiorespiratory status had stabilized at least a little bit, but gradually she lost even her primitive reflexes. She was examined by one of our neurologists, who confirmed that yes, she'd suffered brain death. It was time to stop dialysis and let her have peace. But even after the machine was stopped and she was disconnected from her IVs and ventilator, I stayed in her room. I don't know why. I mean, I know what brain death is, so I know that by that point, she'd moved on to a better place. But I had nothing else to give her. I felt that she deserved someone to bear witness to that moment, to be with her as her spirit left her body. And at that moment, it was me. I'm not ashamed to tell you that I wept, just out of the sheer tragedy of seeing a baby girl who'd never have her nails painted again. I knew that we'd done all that we could do to try to help her, and I've been around the block a time or two. I know that sometimes everything that you can do is still not enough. This was truly a case where there was nothing more we could do. Violet's story is about a lot of things. It's about cruelty and stolen innocence and lost birthdays and things that are deeply wrong in our society. These things aren't easy to talk about, and I'm sorry I had to bring them up in this forum, but there's no way to tell her story honestly without it. And similarly, there's a lot of lessons that you could take from Violet's story. But here's the one that I hope you will. Violet's case provided a vivid reminder that there's always something we can do. It may be a kind word or a listening ear. It may just be your presence, even if you're holding the hand and talking to someone who can't hear you because they're already gone. Disease is cruel, and no matter what you do in medicine, I promise that you're going to come face to face with that cruelty, and you're going to find yourself in situations where there's no more antibiotics to add, there's no more pressors to initiate, there's no more procedures that offer the hope of a different outcome. There are finite limits to medical science. But even then, even when you come against those hard limits, you still have something to offer, your humanity. And ultimately, it's the greatest gift that you can give the patients that you serve. I'm going to close by again saying what an honor it is to be selected by your peers and faculty to join the Gold Humanism Honor Society. Even amidst the tragedies that you'll undoubtedly encounter in your own careers, you'll be blessed to have one of the most wonderful and privileged jobs in the world. We have the opportunity to come alongside our fellow humans in times of distress and sadness and illness, and I know that when those moments present, you'll be up to the task. I'm proud of all of you, and I know your faculty members and families are too. Don't ever lose your humanity or be afraid to feel the emotions, even the uncomfortable ones, because there's always something you can do. Thanks for listening to me.